Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Victoria Dunckley. Victoria Dunckley, author of the Reset Your Child's Brain, is an award-winning integrative child psychiatrist who specializes in children with complex or treatment-resistant mental health conditions. By combining conventional and complementary methods with lifestyle interventions, she aims to optimize treatments while minimizing the need for psychotropic medication. She consults regularly with schools, multidisciplinary treatment teams, and the courts, and is a sought-after expert regarding physiological impact of screen time on the developing nervous system. She has appeared on such outlets as The Today Show, NBC Natural News, and the Investigation Discovery Channel. In her private practice, she has extensive experience treating tics and Tourette syndrome, ADHD, bipolar disorder, attachment disorder, and PTSD. Whether in private or public settings, she is known for going the extra mile to help each patient achieve his or her maximum potential. Out of an overwhelming need, Dr. Dunckley developed the Save Your Child's Brain program in 2010 to offer the general public the pioneering program she was using with her patients to address overstimulation from screen time, a phenomenon she coined electronic screen syndrome. Dr. Dunckley, I'm so excited to have you on the show today because this is such a huge problem that we're facing with all our young kids and now older generation as well.
Yes, that's so true. Thank you for having me, Michael. It is really an issue that touches literally every family.
So how would you classify electronic screen syndrome?
Well, basically, as you mentioned, electronic screen syndrome is essentially a condition where the nervous system becomes overstimulated from too much screen time. So basically, every time a child interacts with a screen device, the brain interprets that stimulation as a form of stress and goes into fight or flight. And that happens not just by one mechanism, but by numerous mechanisms. So there's the blue light from the screen tends to be very arousing because it mimics the sky and tells the brain it's time to be awake. Then there's all the visual stimulation, the very vivid colors, the rapid pace, there's lots of movements or screen changes. And then cognitively, of course, it's very stimulating and activating the reward pathways in the brain at a very unnatural and intense level. And then there's things like multitasking, the interactivity itself is stimulating. So all these things increase the arousal levels. And when this happens day in and day out, it creates what we call hyperarousal. So the child is in this kind of revved up but exhausted state all the time. And when that happens, the frontal lobe, the most developed part of the brain, actually kind of shuts down, and then the child is really operating from a more primitive part of the brain, and that's exactly what they look like. They look very immature, and they're acting out and having all sorts of trouble.
Yeah, so what kind of you're a psychiatrist? I mean that's your profession, and when I think of psychiatrist, and I think of prescribing medication, but. And I know you really worked hard in trying to find foundational things that is driving this child to get to a point where they become dysfunctional. So what do you see? I mean, we see then that the executive part of the brain, the frontal lobe, is shutting down. What kind of behaviors does that translate into so parents out there can recognize what the syndrome, what it looks like?
Yeah, great question. So if we think about what the frontal lobe does, then that tells us kind of what can happen. So the frontal lobe does everything from executive functioning, so focusing, planning, prioritizing, getting things done, to mood regulation, and also things like creativity, impulse control, and even empathy. So any or all of those functions can become impaired. So different children look differently, but a very typical presentation would be a child that can't focus and is highly irritable. Typically, they're struggling in school. They may have some issues, on the playground, or if they're older, just with their friends, or either making friends or keeping friends because they're having trouble socializing appropriately. So a lot of times when a parent comes in, they're saying, my child is having meltdowns, and we're walking around on eggshells around the child. They're smart, but they're not doing well in school. And so I was hearing this kind of story over and over and over again, and we kind of had some sense of that at that time when I first started looking at it, it was really like the early 2000s, so it was really just video games at that point. But we knew even then that video games released dopamine and activated the reward pathways in the brain. So to me, I was like, well, that's just like what stimulant drugs do, so let's take the child off video games. And then lo and behold, when we did that, we noticed the kids would get dramatically better. So I started, and that was, at the time I was working with really difficult cases, kids who'd been abused and neglected and, really had been dealt a bad hand. And even those kids would get much, much better. And if they were stuck, they'd become unstuck. And then I started using that same intervention in my private practice and noticed if the child had anxiety or depression, attention problems, tics, anything, they tended to get better. So I knew it wasn't just the dopamine effects in the brain. It was also something to do with stress, because stress can make anything look worse.
And what kind of impact does that stress have on the brain?
Well, basically, if it happens day in and day out, there's a lot of actual damage that occurs. So, like I said, the frontal lobe kind of gets short-circuited, and the blood flow gets shunted to the more primitive areas of the brain. But you also have stress hormones, both like the immediate stress response with adrenaline, and then chronic stress hormones like cortisol that kind of wreak havoc on every system in the body. So it affects not just the brain, but it also affects hormone regulation, and of course sleep. And even if we just look at the sleep effects alone with the blue light from the screen, that is enough to cause major mental health issues.
Because it's while you're sleeping. I mean, that's when the brain resets, it detoxifies, and it kind of organizes all the events of the prior day. Yeah, it organizes all those impressions, and if your brain is under stress, it doesn't get to do those functions.
Exactly. And you can imagine if that causes problems in an adult, that can cause huge problems in a child whose brain is still developing. So it actually kind of, I call it, it kind of creates drag on development. So because the brain isn't like recuperating every day, the development literally slows down. So over time, you see the child kind of get more and more behind, socially, cognitively, everything.
Because it's kind of like when people that exercise and they're not sleeping well, they think that it's the actual exercise that is causing the muscles to grow, but it's actually while you're sleeping, that is when you're having all the repair taking place. And it's the same with the brain. It's when it's sleeping and be able to be shut down without the stress, that is when it's actually repairing and developing.
Exactly. Yeah. I mean, sleep is absolutely critical. So that's a really key point, because a lot of parents think if their child is just doing educational screen time that it's okay, but that educational screen time still has that blue light from the screen. It still has, the reward reinforcers built into the software. So everything's designed to keep you on the screen, including things that are supposed to be healthy. So all of those things can cause issues with sleep. And what happens is it not only keeps the person awake, it desynchronizes the body clock, suppresses melatonin, which is our sleep hormone, and then suppressed melatonin actually has downstream effects. So it can cause the brain to be more inflamed. It can cause your hormones to kind of go out of whack. And it just causes an inflammatory state in general. And we know things like autism and ADHD, and depression as well. They have abnormal melatonin synthesis and abnormal body clock regulation to begin with. So when you start messing with that system, the child can go haywire very quickly.
Yeah, exactly. We're going to take a quick break. I'm here with Dr. Dunckley. We're talking about the impact of screen time. We'll be right back. Welcome back to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Victoria Dunckley. So you were talking about screen time, and also, we use it a lot as an educational tool. And in school, we have learning games. We have all these different tools just to stimulate the child's brain to learn more. I mean, is that an appropriate way to use electronic screens, or is that even dangerous?
It really is. It really is dangerous. So I think everyone's kind of run away with this idea that these educational games and whatnot are going to revolutionize the way kids learn, and that we've tried so many different things in terms of helping kids with learning disabilities, to autism, to ADHD. There's so many software programs that are designed to try to help these issues. But what we know is that screen time itself makes all these issues worse. So it doesn't even make sense that any of these things would work, and we know that they don't work. So the screens in school thing is a huge issue, and we know that schools that take devices out of the schools, that their scores improve. We know that schools that have the most computer time during the day have the lowest scores worldwide. We know that screens are distracting in the classroom, even when they're being used appropriately. We know that kids and adults, when they take notes by hand versus a laptop, that they process the material better and they perform better on exams. We know that kids read better from paper, and if they're learning how to read, that learning from reading on screen slows them down. So there's so much evidence, suggesting that it's really detrimental to have screens in the classroom. They really need to be used very, very, very judiciously, like the old days when it was like once a week you'd have computer lab for a half an hour or something, So I think it really needs to go back to something more like that. And some schools are just now kind of taking notice of that and pulling way back. And ironically, some of this is happening in the Silicon Valley.
Oh, really?
Because it's all they're looking at the research and realizing that it is hurting kids, and the schools are all about the scores. So if they start to really appreciate the fact that it's lowering scores, they start listening.
So in essence, if you want your child's brain to develop better, you pretty much need to stay away from as much screen time as possible.
Yes, exactly. So, the ironic thing is that the frontal lobe is really where self-discipline occurs. So, and that self-discipline applies to screen time as well as everything else, including money and eating right and all those other things. So when the brain is allowed to develop being relatively screen-free, the frontal lobe functions better and self-discipline is better, and that applies to everything. So a lot of times, families are like, well, we want our child to be a programmer and, be in the tech industry, so they think they should expose them very, very early, but that is actually working against them.
That's fascinating. And so the different factors involved, like you mentioned, you mentioned the blue screen. It keeps the brain awake, so that it's continually stimulated, creating the stress hormones, which then triggers an inflammatory process, and a brain that is inflamed obviously is not functioning very well. And then also you say is that reward system with excessive dopamines, which in itself then makes the brain crave more and more stimulation, which then wears it down, makes it not be able to repair, correct?
Exactly. So those reward pathways actually get desensitized and stop working, and then the child craves more and more stimulation to stay engaged. And we all can relate to that. We've all seen kids who everything that's not screen related is boring to them. They're not interested. They seem really disconnected from the physical world. But that all can be reversed if you remove screens. But I think we're getting so far away from the natural state of what a child is meant to thrive in, and I think we really need to look at that a lot more closely, because we are the current generation, they're being exposed even as babies.
Yeah, and like you mentioned, I mean, the developing brain is even more susceptible, so it's much more vulnerable to that impact.
Yes, and even things like I focus on the mental health issues, obviously, but even if we were to assume that screens didn't cause those problems and maybe helps with educational needs, there's also the issues with eye damage. So it's not just causing kids to be nearsighted; it causes retinal inflammation, and that can lead to a higher risk of macular degeneration, which is the leading cause of blindness. And that used to only happen in middle-aged people, and now we're seeing it happening to people in their 20s. So, and then there's all the musculoskeletal issues. So people tend to think about repetitive stress, like things like carpal tunnel. But now we're seeing, because the kids are hunched over all the time, that their bones are still soft. So when you're growing up that way and you're hunched over, it's a different story, because your bones are soft and they're forming that way, versus an adult that kind of happens over time after their bones have already formed. So it's, again, a much bigger issue, and physical therapists and orthopedics are saying, they're seeing these chronic pain issues in children, which we never, ever used to see before.
And also I know that there's, from what I hear, just the positioning of the screen, meaning that normally when you interact with an individual, you have a certain distance between you and that individual. And the positioning of the screen then will make it harder for a child then to interact with other people around you, just because they're so used to having it so close.
Right. Mm-hmm.
And then also, doesn't also the eye movement, because it's so fixated in that little small area, doesn't that also have an impact on the neural development as well?
Exactly. So that, we're really meant to be looking at a 3D environment and moving our eyes to different distances in different ways, not looking at a 2D screen. So yes, the eye muscles themselves could develop differently, and that could affect an eye-brain connection. I think that whole area is probably still totally emerging research. But even things like the hands, there's a lot of hand-brain development. So there's entire schools that are built on using your hands, kids using their hands to help develop their brain. And now, instead of writing, as soon as a child has trouble writing, they immediately put them on a keyboard. So we're losing all of those things. It's just, and it shows, because we're seeing 1 in 3 kids or entering elementary school now have some kind of developmental issue. Mental health issues have skyrocketed. The suicide rate keeps going up. It's very, everyone keeps looking at the at social media and things like that, which is a true factor. But I think people are really neglecting the impact of screen time. And the other thing is, we know that light at night from screens or otherwise, but obviously screens as a big potent source, is highly associated with depression and even suicide. So, and that has been shown in multiple studies in multiple countries around the world. So the fact that kids are having homework at night on the computer is disturbing, but if they're depressed, it's really disturbing.
It's scary. And is there a certain amount that would be appropriate? I mean, let's say that the child needs to work somewhat on the computer. What is appropriate, and what time during the day is appropriate? I mean, what and how much, and so forth. What
well, it really varies, depending on the kid. So when I work with families, I take everyone off the screens for 4 weeks, And I usually leave the school-based screen time in place just because it's hard to address that. And then if the reset doesn't work, then we'll go back and look at the school piece, and sometimes, we'll have to work with the school to figure it out. But generally, what we do is, we get rid of all the screens at home, and then if they have some computer-based homework, ideally they would get it done at school before they even get home. Some of my families do that. But if they do have to do it at home, we have them do it in a common area so the parent can see what they're doing. They can't be multitasking. They can't be Skyping, texting, on social media while they're doing their work. And what we found is that kids who are taking 3 or 4 hours to get their homework done, all of a sudden they're getting it done in under an hour, because they're not multitasking that whole time.
So it's important for them to stay focused on that one task rather than having their brain go in all these different directions. Yes,
and it's really, usually they, a lot of kids will need someone sitting there physically to help them kind of stay on task. And, if the parent has some kind of blocking software or something like that can help them stay on task, sometimes that helps. But it really is just a huge distraction. I mean, even for myself, like the minute I pick up my phone to check an email or something, there's like 10 other things that pop out at me that distract me, So I can imagine for kids, it's constant distraction.
Yeah, and like you mentioned, that overstimulation that kind of fries up their executive thinking component.
Right, and it's really, switching tasks is also really taxing on the brain. So when they're doing the multitasking, it really drains reserves. And also just all the, suppressing things. So they have to suppress an ad that comes up, or, if a notification pops up, they have to suppress a lot of material to stay on task. And all of that takes energy, too. So if you think of a kid that's hard enough for a kid who's developing well, but if a kid has any kind of underlying mental health or learning disorder or attention issue, it's really, really hard.
Yeah, and the brain uses up more sugar resources pretty much or energy resources than any other part of the body.
That's right.
Yeah. We're going to take a quick break. I'm Dr. Michael Karlfeldt. You're listening to HealthMade Radio, and we're talking about your child's brain health. I'm here with Dr. Victoria Dunckley. Welcome back to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with Victoria Dunckley. She's the author of Reset Your Child's Brain. So you have all these children that are literally addicted to screen time. I mean, because it is an addiction, with the dopamine that's being released and they craving more and more. How do you reset that child's brain? How do you get them away from that?
Yes, well, as I mentioned, the first thing I do with every family I see, if it's the first time I'm seeing them or if things are going downhill, we do what I call the electronic fast. So that is basically a screen fast for 4 weeks or longer. And we really focus on the interactive screen time. So this phones, iPads, tablets, laptops, no social media, no texting, no scrolling through pictures on a phone, nothing. So we really want to get rid of that interactive screen time. And I do allow 5 hours or less per week of a TV or movie if it's slow-paced and non-animated, and watched on the TV across the room. So some families just leave that out too. But basically, if you do that with the interactive screen time, what happens is the brain is allowed to get deep rest again. And it's kind of like a body in motion stays in motion. So when they have all that stimulation, it keeps that hyperarousal going, even if they kind of cut down. So a lot of times parents will say, well, we want to cut back. And I'm like, well, you could try, but they're not going to really get better until we remove all that stimulation altogether. So the brain really needs a extended break to settle down again, get those deep stages of sleep again, so that it can repair during the nighttime, like you were mentioning, and then also to reset the body clock, lower the stress hormones. The reward pathways become sensitized again, and once once the option of them not being on a screen is removed, and they have to know that it's really removed, then they'll start doing other things and engaging in activities that they weren't doing before. So littler kids will go outside more and play more creatively. Older kids start talking more face-to-face, picking up hobbies and stuff that they might have done before, and just becoming more interested in screen-free things. So parents are always worried that their kid has no interest and that they won't do anything. But really, even with teenagers, after the first week, even teenagers will start to come around and engage again.
So it's almost like being bored is important, because
Absolutely.
that is
Yes.
Because that is when the brain then starts to think of other things to do, rather than just going for the screen time. And I would assume also that because there is such a huge issue with children just craving sugar and craving foods that are very stimulatory, that plays a huge part of it as well. When you're stimulating the brain and it's craving that stimulation, you're also looking for food that does the same thing. And if you give them that electronic screen fast, like you're saying, that would also then start to reset the kind of food that they're craving.
That is absolutely right. And what we see is that kids, even after a single use, they tend to eat more afterwards. So we think that it's not just that they're being sedentary, because there's a huge association with screen time and being overweight and other metabolic issues. But it's not just being sedentary. It's doing something to the signaling, the satiety signals, and also just blood sugar regulation in general. So we know that even when kids are active, there's a higher rate of high blood pressure and high blood sugar, and being at risk for diabetes, the more screen time that they have. So that tells us that it's really a physiological response, and it probably has to do with cortisol.
Yeah, that cortisol, which impacts, like you mentioned, your blood sugar regulation, your inflammatory control, and they associated a lot of these, ADD, ADHD, anxiety, depression, autism, with the brain literally being inflamed.
Right.
And
I've even seen in some of my young adults when I've done this, that I just had someone recently that lost like 40 pounds within 6 weeks of going off the iPad.
Oh, really?
And we had checked his lipid panel just before we started, and then he had lost so much weight. I was like, let's just check your lipid panel again and see what happened. And it went from being highly abnormal to normal just within 6 weeks.
Just getting off screen time, losing 40 pounds, and blood panels normalizing, and the only thing getting off the screen.
Right.
That's
incredible. And since then, I've heard from other practitioners who've noticed that same effect in their patients. So it's very interesting, and that's another, having high cholesterol is another issue that we didn't used to see in young people that we're seeing now.
Yeah, and cholesterol tends to be a response to inflammation. So if you reduce that inflammatory process, which, like you mentioned, cortisol plays a huge role, then you're going to see more cholesterol and you're going to see more cardiovascular disease.
Correct.
So parents out there, they kind of recognize that, this is important, but when you have difficult children, it can become quite challenging to start this process of screen time fast. What are some tips that you have for these parents?
Well, I think to start, you really just need the education piece. So the more that parents understand the physiology of it and how it creates those different mechanisms in the brain and how those mechanisms translate into symptoms that they see in their child, when they get that connection, then they're more motivated to do something about it. If they don't understand the why, then it's it's like telling someone to eat right without telling them what's going on in their body. So we start with that, and then if the parent's ready to go, that's great. If they're not ready to go, then we look at what are the underlying what's the underlying resistance? So is it that they are still not quite sure that they believe that this is what the problem is? Is it because they don't have enough support and they rely on electronics as a babysitter? Is it because they don't want to, part of the program is that you spend time with the child because the bonding pathways actually replace these addiction pathways. So that's part of the program. But sometimes parents don't want to spend time with their kids because their kids are acting so horribly, So we have to, uncover that issue, if that is an issue, work on support, and just kind of figure out why they don't want to do it. And that can sometimes, take one session, or it can take 8 months. But we keep working on that and keep planting seeds, and I try not to push people, but just remind them, if we're still in the same position in a few months from now, like we need to rethink whether you want to try this. And we always just start with 4 weeks. So if you just think about the 4-week period as an experiment and try not to think about this as a lifelong change, then that helps the parent not feel so overwhelmed. If they can just get through the 4 weeks, and then a lot of times when they see the dramatic effects, especially if they have a kid like with autism or something like that, then they're much more motivated to keep going because it's really quite profound, the changes that we see. And the kids who are the most vulnerable, have some of the most dramatic responses. I've seen kids who, little boys who start reading all of a sudden. A lot of these learning disabilities that have been diagnosed, they seem to disappear because the child can focus and remember and process material. And of course, they're more physically active, so that of course helps the brain too. So a lot of the things disappear, but even if they do have an underlying disorder, it's going to be much, much better and more manageable.
So you mentioned even autism. You've seen changes in when you get them off the screen.
Yes, huge. So we see differences in their levels of aggression or self-injurious behavior. The repetitive behaviors go down because those are really linked to dopamine and kind of obsessive compulsive pathways that get activated by screens. And again, these are the same things we see in kids with when we give kids stimulants. So if you give an autistic child a stimulant, like if they have autism and ADHD, sometimes they're prescribed stimulants, we see the same thing. Like we see them having more repetitive behaviors and more OCD symptoms. So it's the same with screen time. When we remove that screen time, those things tend to get better. But the really exciting thing is that you sometimes will see them making better eye contact, they're smiling more, some of them start speaking more. So it's really, really significant changes that we see in kids with autism.
That's really fascinating. Like you mentioned, that it's the same pathways, the kind of the neurotransmitters or the hormones that relate to connection with individuals as that kind of dopamine pathways that's being stimulated by the screen time. So if you remove the screen time, then that's being then replaced with the need for connection with individuals. Right. That's really amazing. We're going to take a quick break. I'm here with Dr. Dunckley, and we are saving your child's brain to get it off, from screen time. So this is a very, very important chat that we're having. We'll be right back. Welcome back to HealthMade Radio. I'm Dr. Mike Karlfeldt. I'm here with Dr. Victoria Dunckley. She's the author of Reset Your Child's Brain, and it's a 4-week plan to end the meltdowns of your children, raise their grade, boost their social skills, and also reversing all the effects of the electronic screen time. And it's becoming a big plague in this millennia that we're in. So how do you, we've been talking a little bit about what parents can do, and what I know in one of your chapters is really focusing on setting your child up for success. And do you have any more advice in that area?
Setting them up for success during the fast, you mean?
Yes, during the fast.
Yeah, so you want to there's several days of planning that occur. So you really want to get rid of all the devices in the house except for the bare minimum that you need to survive. You want to look at what the child's doing each day so that you don't have a babysitter or something like that, or daycare or something like that that's going to undermine your plan. And you also want to plan activities. And what we have families do is they plan activities as a family and also one-on-one. So if there's 2 parents in the house and 2 kids, let's say, each parent takes 1 kid once a week, ideally, and then they swap. If there's grandparents involved, we have them, a kid one at a time go to the grandparents. So that helps. One-on-one time is really important to help activate those bonding pathways. And I think I mentioned earlier, those bonding pathways or the attachment pathways are protective. And those are the same pathways that get hijacked with technology addiction, actually with all addictions. Those are pathways that are meant to keep the child close to the parents to survive. So when we spend more time with our children and are making that eye contact and having that face-to-face conversation, that helps protect against them even needing screens in the first place. So a lot of the high-risk screen activities are the ones that are the social. So like the online role-playing games, when people play in teams and things like that, those are way more addicting. We know social media is very addictive because of the social component. So that's we need to replace that, with something healthy.
And in regards to that also, are there certain types that are worse than others when you deal with screen time? I mean, you mentioned that those interactive games, they're more addictive. Are there ones that are less harmful than others?
Possibly, but I think the differences are pretty small. So what we, and of course violent video games are the worst. And they have their own unique effects. But what we see is really that total screen time predicts whether there's going to be a problem more so than what kind of screen time they're doing or what type of activity they're doing. So that's really important for parents to know, because it's total screen time and also earlier age of use. So total lifetime use is a risk factor. So the more they're exposed to the screen, no matter what it is, then that increases their risk each time. So some of the most, creative games like Minecraft, parents let their kids use because they think their kids are doing something not just benign, but they think it's helping their brain because they think they're building something. But Minecraft is incredibly addictive, and I've had even kids will talk about how addictive it is. And if you Google Minecraft addiction, you're going to see like 1 million mom blogs and stuff like that, because their moms are like, what do I do? So and things like Pokemon Go, which seemed like it was framed as a very positive thing because it was getting people out of the house, but that one was incredibly addictive as well. So you have to really be careful, because those addictive changes, those are causing brain changes, and we know that technology addiction, we now have brain imaging studies on young adults with technology addiction, and the brain damage looks very similar to alcohol and drug damage. So we thought it was going to be, more similar to like a behavioral addiction like gambling or something, but in fact the brain changes look more like substance abuse.
That's really scary that you can have that kind of impact. So it just shows the amount of stress that the child goes through, by being in front of that screen, the expanded impact that it has on brain, but all parts of your body.
Right.
So,
and if you think about, when we think about alcohol and drugs, you're ingesting something, so it makes sense that there would be damage. But with screens, the eyes are actually part of the central nervous system. So the eyes are the only part of the central nervous system that's exposed to the outside world. So if you think about, if you're bombarding your eyes all the time with artificial intense stimulation, it makes sense that it's going to cause some kind of changes in the brain.
And like you mentioned, the individual that lost weight, his liver panels changed, meaning his liver directly changed based upon him not staring at a screen.
Right.
So, and in that, you've kind of going through all the different changes that its impact. I mean, you mentioned, obviously the mood, is impacted by it. You have the social interactions. You have the stress hormones. Cortisol. You have that inflammation that happens. The oxidative stress. You have disturbed sleep. You have also you kind of don't have that feeling of time. You get in that survival mode, and everything is got to be done right now. Everything becomes overwhelming. But then also the learning abilities, difficulty learning, have a hard time with attention. So it really impacts all of these areas just from being in front of a screen.
Right. And it really reaches all of those areas too, in terms of how the child functions. It really, even the time thing, a lot of kids these days, they don't know how to tell time, of course, and they don't even teach analog clocks anymore. So that's one thing that we teach in my practice is getting a watch that has an analog watch, learning how to tell time, because it's different. When you see the hands move around, then you get a grasp and you have some kind of context of time. But even being immersed, like you were saying, that being immersed in an activity, they lose their sense of time. Time slows down, so they don't have a sense. They don't have a sense of time. They don't have like a sense of 20 minutes, and they also don't have a sense of 2 weeks from now or 2 days ago. It looks really similar to kids with trauma. They don't have a sense of time either. So these are the kind of things that manifest and that cause dysfunction, but it's really hard. It's hard to make that link unless you understand all the physiology part.
And I'm curious also, I mean, you're talking about dopamine, and we have a classic condition that is a dopamine deficiency called Parkinson's. Has there been any kind of correlation between screen time and a condition even as severe as that?
Not that I know of, but I wouldn't be surprised. I do have some patients that I've heard of that are, spouses of patients that have Parkinson's who are on their screens all the time. Would they get better if they went off? I'm sure they would, just from the sleep benefits alone. But I think what I'm seeing is virtually all, I used to just say all psychiatric, but now I'm seeing pretty much all neurological things get worse too. So, seizures can get worse, migraines can get worse, tics. So if there's other neurological syndromes that can, especially that are sensitive to the environment, it makes sense that those would probably be sensitive to screen time as well.
And then we have the issue of the electromagnetic fields. Each individual, they have their biofield, and then you're introducing an artificial electromagnetic field into your space all the time. I mean, what impact would that have?
Well, it turns out that it has kind of synergistic effects as the screen time itself. So what we know is there are studies showing that EMFs can suppress melatonin. We know that it kind of causes a stress response and can raise blood pressure and blood sugar. We know it can affect sleep, and it's kind of excitatory and inflammatory in general. So basically the same kind of effect. So it's now that everything's wireless. When I first started working on this issue, we didn't really even have Wi-Fi or anything like that. So those effects, at that time weren't compounding it. Now, when kids are doing their activities using Wi-Fi or they're using a cell phone to do it, you definitely are compounding all of those effects and making it worse. So that's why a lot of the kids I see, they don't really have that much screen time. Some of them only have like once a week that they get to play something, but when we remove it, they still get better. So it just shows us that that developing nervous system is very sensitive. So when you have all this artificial stimulation bombarding them all the time, something's going to happen. So the most resilient kids will have a little bit more tolerance, but over time, we all have a tipping point where things are going to start to break down.
Yeah, and it's fascinating to me to see teenagers when I interact with them in my clinic. and they're asked to hand their phone over to their parent, it becomes like you're almost ripping a piece of them away from them. So they get, it's like addictive just to have that, the energy or the frequency of that cell phone around them all the time.
Right. And I think, it's like you're taking away one of their limbs. But I think because that happens, I think a lot of people, when they talk about interventions, they say, well, let them have the phone nearby, just turn it off so that they don't become anxious. But that's really not the way to handle it. It's like saying, it's like letting an addict, look at their drug of choice just so they can look at it. So, the kids really need to grieve when it's gone. So if they think they're going to get it on the weekend or something, then they're just thinking about that the whole week. I can't wait to get my fix. So with the 4 weeks, though, it's enough time that they kind of have to accept that it's gone and that it might not even come back at 4 weeks. So we don't promise anything. That 4 weeks is just to start, but that forces them to kind of grieve it and realize that they can live without it.
Wonderful. Well,
and it's really eye-opening. And of course, I love it when kids give testimonies themselves, especially teenagers. But a lot of them feel a lot of relief because they don't realize how it's affecting them until it's gone.
No. Yeah, it's amazing. Well, Dr. Dunckley, it's been such an honor to have you on the show, and your brain, I really urge every parent, not only parents, but everyone to get your book, Reset Your Child's Brain. It is, I believe it's a groundbreaking book, and this is something that will pretty much save children from so many unnecessary medication, and I just see our country taking a downturn, and I think that all the screen time is a big factor, plays a huge role in it. So thank you so much for all your work in this area.
Thank you, Michael. It's been a pleasure.
That is it for today. You're listening to HealthMade Radio. Remember, check us out at healthmade.co. Health is what you make it. Is what you make it. Is what you make it.